Good morning, Oklahoma, and welcome to Cow-Calf Corner. We've had a welcome change in the summer heat. It's finally relented for us, having some pleasant overnight temperatures. It's led Dr. Parker Henley and I into the discussion as we deal with some of these cold nights and hot days, the repercussions it has, particularly on the health of baby calves or fall-born calves. So our topic this week is to think about fall vaccinations at fall branding time, and I appreciate Dr. Henley taking time away from his preparation with the livestock judging team and getting ready for Louisville. Parker, what should we be looking at this time of year relative to those calves that are 2-3 months old?
Yeah, absolutely. Well, you're right in the fact that these temperature changes are only going to get worse as we go throughout the fall here, and it's a perfect time. We're 30 days out from the start of the breeding season if you're a September calving fall cow calving herd, and so it's perfect time for branding time of our calves, which is a term that was historically utilized by ranchers when they would actually put a hot iron brand on their calves. Now, that's typically not used as much anymore, and identification such as an ear tag is become more common. And so that name, though, has stuck with this working period of our calves. And so vaccinations are incredibly important at decreasing the chance of disease for your fall-born calves. And if we can work those calves and then turn them back out with their mothers and get them in a familiar environment, they tend to have less stress. The vaccinations tend to work better, and there's just a whole lot better outcome, and production parameters are increased of those calves.
Parker, I know we talk about establishing that vet-client relationship and talking with a vet specific to your region, your operation, about what vaccines ought to be used, but some big bullet points. What kind of vaccines are we looking at getting that first round of into calves right now?
Sure. And so, as you mentioned, that vet-client relationship is extremely important because your local veterinarian or health experts the only person that's going to know of the issues that are strong or happening in your region. And so, the big things that we recommend you do at this branding time would be individually identify your calves, number one, castrate them. Potentially, if you have horned calves, go ahead and dehorn those calves. Additionally, growth implants may be an option. And then the big things would be vaccinating for BRD or bovine respiratory disease in some form. Also providing a black leg or a 7 to 8 way vaccination for those type of things. And then we also recommend a parasite control as well. So in terms of brands and types, those are the things that become very hard. Only you and your vet and current prices and what's available to you in today's world with supply chain shortages, maybe only one type available, as well as the price also. So to have that discussion with your vet and that relationship, and I think you'll come out on top.
Parker, I appreciate your time, and probably the final point on this, depending on when we calved in the fall, getting those boosters into the cow herd and thinking about boostering them, getting prepped and primed for breeding season, just being a few weeks away, all at the same time we work those calves would be important. Thank you all for joining us on Cow-Calf Corner this week.